Well, all right. Good evening, everyone. It's 6 o'clock, and I'm going to call to order this regular meeting of the Dunn County Health and Human Services Board for Thursday, January 27th. Welcome to members of the community who may be watching on our YouTube channel. My screen indicates that all of the members of the Health and Human Services Board are present, including County Board Chairman David Bartlett. Dr. Alex Hall is joining us, but she indicated that she would be a few minutes late. So let the record show that everyone is here. We are going to need approval of the minutes for December 16th. They need to be amended to indicate that regrettably Sarah Kennedy was not with us. Dr. Hall has just joined. So I would like a motion to approve the minutes of the December 16 meeting as amended. Supervisor Steen, is there second? Supervisor Bjork seconds. Any additional corrections, additional discussion? If not, all in favor of approving these minutes, say aye.
Aye.
Aye. Opposed? December 16 minutes are approved. Ken, do we have any public comment for tonight?
There was nothing I saw. Nothing.
Okay, there is no public comment. Next item of business is our next meeting date for February 24th. I assume that still works with everyone, our fourth Thursday schedule. And let's hope it's a little warmer by the time we get there. Barbara Fagan is not with us, is she?
No, but oh, hold on. She's messaging me.
Okay.
So waiting for the host to enter. Oh, let me fix that.
We asked Assistant Corporation Counsel Barbara Fagan to be with us to talk about the opioid settlement. This was a request from Mr. Lamb, and I think it's a good idea. It's kind of a complicated settlement over a long period of time. So we will await Ms. Fagan to join us.
Should be here in a second.
This technology is quite wonderful and quite horrible simultaneously, isn't it?
It is. I see she saw my message, so she should be there. She is.
It's only horrible if you don't know how to mute yourself.
I will tell you guys that after this meeting, I'm going to pull multiple invites off the calendar and just redo. So you're going to get a bunch of cancellations, and then I'll fix it because it's gotten confusing. So I've learned now just to send you the link in an email, but there's a few links out there for the meeting. And so that was part of, I think Barbara was on another one of the links. So anyway, I'm going to fix that right after, like tomorrow. And
there were multiple entries in calendar too.
Yeah, when you get all of those, it's going to look like I'm canceling all the meetings, and I am, because then I'll resend it.
Okay. Well, welcome, Barbara. We are glad to see you. You are muted.
Thank you.
There you are. We've asked Assistant Corporation Counsel Barbara Fagan to join us to talk about the opioid settlement, and maybe Barbara, a little bit of background for those who might not have as much information as the county board members may about the court cases and the settlement.
Sure. So the state of Wisconsin is joined with the other states and in the union to initiate a class action lawsuit against some of the larger opioid manufacturers as well as the distributors. And it was the goal in engaging the class action and and ultimately how this is resolved in a settlement is because basically the manufacturers and the distributors, rather than having numerous small lawsuits, a lawsuit that Dunn County brings, or Dunn County and Barron County, a lawsuit that the state of Wisconsin brings, a lawsuit that Texas brings, rather than having all of these multiple lawsuits from municipalities, the distributors and the manufacturers, as well as the counties and various states, wanted a global resolution to have a final settlement that resolves much of and abates much of the financial issues to municipalities that has been incurred by the opioid epidemic. So it's not just Wisconsin suing the manufacturers and distributors. We're in tandem with other municipalities across the country. And so the county board came together in December in a special meeting in order to approve going into a settlement for the opioid epidemic and having a final resolution toward that. All 72 counties in Wisconsin had resolutions that approved that, which makes Wisconsin one of the leaders as far as having the most number of participants in agreement. Across the country, some municipalities are holding out on the ultimate settlement. They had until yesterday, January 26th, for all of the plaintiffs to come together and agree to be part of ultimately what a resolution has been. And so it's not just Wisconsin specific. We're tethered to the other states as well. But there is some movement towards a conclusion towards this. It is somewhat premature because it's not a done deal. The settlement offer would have been tendered to the defendants yesterday, and they have until the 25th of February in order to yay or nay it. They would have the opportunity to nay it as well, although the court was very instrumental in leading the path towards what an appropriate settlement looked like. So it's anticipated that the defendants will agree with ultimately what is put on the table. Then it needs to come back before municipalities in order to have the municipalities then ultimately actually approve what was given to them or what is presented to them on each municipality level, but the actual chunk would be defined. There's some steps that will need to be worked out through the class action attorneys. There's two firms that are kind of representing our class here in Wisconsin. So there's some logistical steps as far as naming depositories that the money would go in, determining how the funds would be tendered. There's options, just as if when you're sitting around watching TV, late at night and you see the commercials that say, "Don't wait for your structured settlement. Call us and we'll give you all the money right now." Those things are potentially an opportunity for municipalities as well. So there's a lot of logistical rollout in addition to the final numbers not being finalized. But in the state of Wisconsin, the ultimate, I have the ultimate allocation was something in the neighborhood of $402 million, and the courts and the attorneys worked out an allocation percentage based on a number of factors for each county. And so the county of Dunn has been allocated at this initial stage, so it's not finalized yet, a 0.442% of that $402 million, which comes out to be about $1,200,000 and a little bit more. But as I indicated with my little commercial joke there, the settlement is a structured settlement, which means that it comes in various times. So the money, if it's ultimately approved, they're expecting, after we work through all of those issues on how the money's distributed, who's going to oversee it and things like that, it would be distributed between, sometime the first installment would be between March and July to Dunn County, to another one and a second one in July, and then it would be annually thereafter for a period up to 18 years. The opioid manufacturers have 9 years to pay back, and then the distributors, according to the current terms, have 18 years to pay that allocation out, which frankly doesn't, $1.2 million sounds like a really large amount of money that we should be very excited about, and we should be, but when you break that up over potentially 18 years, although there's some front ending, it works out to be closer to that $70,000 a year mark. So it's not a gigantic amount of money, certainly nothing to sneeze at, but we won't have 1.2, it's for certain that we won't have $1.2 million in one fell swoop. So one of the not a sticking point, but one of the things that should be on the committee's radar and the county board's radar is that the money, there's definitely some restraints and some parameters on how that money can be used. It's restricted as to how that money, to what programs that money could be used, because it's not just money to pay the bills, it's money that has to be targeted towards the abatement of the epidemic. So I believe in the county board packet, there was a approved programs list. And so there's a number of approved programs that are outlined in that document. It's about 15 pages of various programs. And so at this preliminary stage, identifying those programs that Dunn County has, or that Dunn County could expand on, or potentially Dunn County could create, would be the steps that could be going on right now, is identifying those, so that come March, that March, July, that first installment payment, that there's a way to, there's an anticipation to direct that money at this time. And so that would be my suggestion at this point, as far as what the county could be doing. But that is my overall kind of high level look at this resolution. Still, like I said, a little premature, not a done deal, but it's looking pretty promising.
Thank you, Barbara. Questions of Barbara for with regard to the legalities in the settlement?
No, just thank you for the summary, Barbara. Really appreciated it. Thanks.
Thank you.
Chris, I assume that there has been some discussion of this, however preliminary.
Limited, just
Okay.
because the numbers are all still new and kind
Absolutely.
of moving around, and the details of it all, but a little tiny bit of it is, people started to talk about it. Some people are more anxious to chomping at the bits, but
Okay. Well, undoubtedly, this topic will come back to us at some point when more of the formalities are accomplished. So, any other questions before we move on? If none, let's move on to veteran service. Greg, are you ready?
I am. I just needed to adjust things. Good evening, everyone. I had followed up an email. Was missing a few documents in my report in the mailing. They were posted that same day or the next day on the county's website. And so there's additional documents I sent out in an email, included the expenditure and revenues completing up for 2021. So what I will do is start off with the memo formatted document, just kind of given a little bit of a snapshot of what's been going on over the last reporting period. Locally, I'd included in your packet, there's a fundraiser, a lot of generous people in the area, and we were contacted by the Moose Lodge, wanted to find out if we were willing to accept some money on a fundraiser that they were doing. So we just asked them what they need. So I'll be there flipping pancakes on Sunday. So which is nice of them. So we'll be there, and the money will go into the Veterans Relief Fund. But thankfully, this last year we've seen actually a decrease in requests for veteran relief funds, which you'll see when I talk about the expenditures. The other item last Friday, and I know this is more of a December report, but I thought it was noteworthy. I met with the Alpha Company of the 128 Infantry last Friday. They had a longer training weekend, and so I partnered with VA social worker. We went down and talked about the benefits of some of the VA programs. More specifically, is healthcare. We try to reach the young veterans right away before they start in their careers, because this group just returned from Afghanistan probably 8-9 months ago, and so I think in the room there's probably 60-70 troops, and about 80% of them had all deployed to Afghanistan, which immediately qualifies them for VA healthcare, because nothing is ever an automatic. But this is the way that we can try to encourage young troops to enroll in VA healthcare. And what I just talked about, the long-term benefits, because I work with so many that come in when they're 70 years old to try to engage in the VA for healthcare as they're getting ready for retirement. And sometimes we got to jump through a few more hoops to get them enrolled. But once you're in, you're in. So that's what we went over with the young troops. And so I think that went well. I got a follow up from the VA social worker, because the advancements in technology and the younger generation, he showed up with a QR code for these and just had these kids take a snapshot, enter their information, and they were getting bombarded with stuff from the VA right away. So there's a positive of the technology and working with the younger generation. So on the state benefits, there's nothing new to report at the end of this last year. And on the federal benefits, we're still seeing an extremely bogged down appeal system within the VA. There's a number of different types of appeals, but most specifically, they're called notice of disagreements that get us an actual hearing with a veterans law judge, which is the last shot within the VA before it jumps out to the Court of Appeals for veterans claims. And we've got some lengthy appeals sitting out there that is a little discouraging. But the reading some of the information come out of the VA, there's relief in sight, but we're not seeing it yet. And so we'll continue to monitor that. And that's something we kick up to our local representatives as well, because they can have some pull in fixing that problem. On the financial end, I met with Sarah Stabenow, the finance manager, to just clean up a couple year-end items. And I hope I didn't make too much work for, because I had to just do some journal entries, clean some stuff up. So just to make sure that we're getting things closed out. We're a little bit more fortunate than some of the other programs, because we're not sitting waiting for 30, 60, 90 days old revenue to come in to clean things up. And then regarding just the COVID stuff, again, we attempted to do some split operations just at the height of this new variant, but we just because of the high op temp, we brought brought Jessica, a coworker. We need to have somebody now. So then we need both of us here, just because it's difficult to predict walk-ins and stuff. So we just got back to business as usual. But we made an attempt to try to limit some of the contact and stuff. But we have yet to have any contact tracing phone calls over these past couple of years. So I think that the people coming in and seeing us are following good practices. And I hope that we're viewed the same in here. So we're back to business as usual. Same volunteers, full staff. We added an intern. She just started today. And I was going to have her on tonight, but I figured it was probably too much for day one to bring her on. But
we're too scary for somebody's first day.
Yeah. So that'll be nice. Very, very motivated and eager as all students are. So I think that'll give us some added energy and help to work on some other special projects that we're not quite able to close the loop on. So we're looking forward to that. So the next item, I will move to the on the budget side with the revenue and expenditures. As I said, there's really nothing significant. You know, we actually have there's some money left over at the end of the fiscal year, and a lot of that's really attributed to not needing some of the relief funds. And again, I think there's a robust amount of funds due to the COVID and some stimulus that it has really limited some of the requests coming our way and a variety of other things that have been available. So that's been a positive. So I attribute that, and then you know, again, not spending as much in travel, things like that. You know, you can, you know, a budget is nothing more than an estimate, you know, that you hope to hit at the end of the year. And so we've met that and haven't had any other items that have popped up to cause any concern. So if there's not any specific questions, I can jump into the client served report.
Excuse me, Greg. Supervisor Bjork, did you have a question?
Well, Greg, I was just assuming that at the beginning of your presentation with meeting with the company A, that is our local reserves guard, National Guard.
It is. I apologize for not elaborating. Sometimes I start talking as if everybody knows what we know, right? So that is, the armory on the south end of Menominee. That is it's a Wisconsin, it's a company, infantry company of the Wisconsin National Guard that's housed here in Menominee. Interestingly enough, there's not many Dunn County troops there. They're from all over the state, which I found interesting. But that's that loyalty and dedication, you know, that and you go where the job is. So they said question there.
So those were troops of what age approximately that you were talking about?
So I would estimate probably the youngest was probably 19 up to majority of them up to the age of 30. And then of course your young leadership is going to trend up to knocking on the door of around 40, I would say.
So most of those troops would be leaving family and jobs behind to go do their National Guard work at Afghanistan, right?
Oh, absolutely, without a doubt, and their education.
Thank you very much.
Any other questions? Any budget specific questions for Greg before he moves on? Okay, Greg.
I'll draw your attention to the client served report, and I'll answer specific questions about any of the other the numbers that are articulated in there, but I specifically focus on the impact. And so they have a couple impact statements that we included in here, and the one is kind of a follow on for for one of our veterans, and just getting some additional funds that come in. And I'll just to give kind of a larger overview. When a veteran achieves a 30% disability, according to the VA, they are eligible for travel pay, and when they achieve a 50% or greater, they're able to receive reimbursements for any co-payments that they might have made, or medication co-payments that date back to, in this case, it was an appeal that was about 7 years old. So there's a lot of follow-on work. Once you celebrate the win, then there's a lot of follow-on work just to ensure that all the details are not missed. And so with this family, and he's been bringing in a variety of amounts, but he's over these 7 years, he's paid out over $5,000 in co-payment costs for care at the VA, which is still low. I mean, that's great co-payment. But between travel pay and those amounts, he's gotten over $5,000 in addition to what he had received before, because he technically, going back to that appeal date 7 years ago, he shouldn't have been paying those items. So again, and those are the details, I would say, that call it the claims management. If we just leave it at that initial part, we're like, hey, great, we've achieved this nice back pay, and don't look at that next level stuff with the travel pay qualification, adding dependents, getting reimbursed for stuff. That's significant, especially when families went without for that long. We better dig in and get them what they've earned. And then the additional one is actually another veteran. And I've talked about this one so much. I'm hoping that this is not a repeat, because I've talked to about, just because this guy's it's not often when you come across what I will call a combat war hero. And this gentleman was earning a Distinguished Flying Cross, which is a valorous award, because he was part of the Normandy invasion and was with some of the bombing attacks and stuff. So he unfortunately had attempted. He had some significant challenges, hospitalized up at the Minneapolis VA, and thankfully, in working with them, he's got a nice safety net and made sure any follow-on ongoing care is all covered, and he's in assisted living, but he's in Minneapolis now, and his daughter is helping out with some of his caregiving and stuff. But it was we did an appeal. It was a lower level appeal, and they agreed with us that there was enough symptoms, the significance of the PTSD, and then as well as dementia be caused as a secondary. So I think that was a nice thing, and it was nice that the VA recognized that and took another look at it, especially for those that aren't going to be with us as long, to enjoy a lot of that safety and security that they should have had their whole life.
Right.
Any specific questions? Any of the analysis with the Veteran Serve report?
Any questions for Greg? Hearing none. Oh, I'm sorry, Supervisor Steen.
Yeah, Greg, just a question here on your hold up on the appeals and all that stuff. Are you interacting with any representatives or senators or anything following up on that?
I've let Mr. Alman, Ron Kine's office, he's been doing veterans advocacy for a long time, and he's very, very responsive. So locally, he's one of our main contacts. And again, in a lot of these environments, it's all who you know, to get quicker answers. And Mr. Alman has been doing it long enough, and he gets us some answers, but well aware of these long, lengthy delays. Yes.
Thank you.
I'm glad that Mark can help you. He's quite efficient. Okay, anything else? Additional questions? As always, Greg, clear, concise, informative, helpful. Thank you very much. We appreciate this. Okay, moving on to the Department of Public Health report. You had a lot of additional documents that were posted online earlier this week. KT, go ahead, please.
I did. And so if it would be helpful, I can also share my screen so that we can talk through them together. Okay. Let me get to the different. So as always, I did give you guys the influenza report. I think it's important to know that we are seeing regionally an increase in cases, but not locally. That's important to think about as far as co-infection and kind of that twin impact to our healthcare system potentially. And then starting off with COVID, you had, Supervisor Morehouse had asked for kind of a deeper dive in COVID. So just framing our numbers right now, this is by onset or diagnosis. What's in the SITREP is by date reported. So they're slightly different, but ultimately they are the same. So looking at, 10,526 PCR confirmed cases, and then almost another 2,000 probable cases. And those probable cases are rapid antigen cases, as well as when very early in the pandemic, when testing was not available, if you meet the case definition, if you were a household contact to a known positive and you were symptomatic. So just for full disclosure, there are a handful of folks that do meet the definition in probable cases that were not tested. But the vast majority of probable cases are rapid antigen tests from our school-based testing, as well as our community testing site at UW Stout. And you can see the numbers are quite stark. These last couple of weeks, we have had 7-day averages that were well over our peak in November 2020. So just to kind of frame things up. And then the other, so that's the situation report that you guys received. That should look very familiar as far as the bits that I grabbed from the Wisconsin DHS. And if you guys have any questions, definitely let me know. I do want to point out that in my struggles with formatting in Word, that there was a cutoff to one of the infographics that Dr. Hall actually makes available to us, and on her social media accounts about cases over time. And I think one of the things that's really fantastic about what Dr. Hall does is that there is that 3-county comparison, which is sometimes helpful to see yourself in. And so there was an update. I don't know how it happened. It's very obviously truncated, but it is missing the last 3 dates. So I'll make sure that you guys have that available to you later. But again, looking at the data here, it's very similar for our local data. I will point out that we have had 2 new deaths. One was new and one was subject to autopsy that just finally came back. So we are at 65 deaths. Our hospitalizations have gone down, and I think that that's really important to know, that we are not seeing the same kind of hospitalization. And so one of the things that I added that I don't typically add is from the Healthcare Emergency Readiness Coalition that gives you a good sense of where we are. This is back-end data that is provided to the state from the HERCs, as they're called. And what you'll see is that we are seeing some alleviation of the incredible strain locally on our regional healthcare systems. And that's great. That's really great. So I wanted to make sure that I pointed out what you were looking at with that. And then one of the other things that I wanted to talk through, the right tab, is the money of COVID-19 as it relates to the Dunn County Health Department. So we received, this is kind of braided funding in its best and worst, several different funding streams from both state and federal pots, and they came to the health department as they came to all health departments that elected to take the money with different spend out dates. So I wanted to just give you the money in one glance. So the first amount, the Public Health Emergency Preparedness or FEP grant, came through as basically doubling our current annual allotment to give us some quick infusion of cash, and that was state dollars. Passed through some of the emergency preparedness federal dollars from years past. And then additional allocations with enhancing lab capacity or ELC, CARES, and enhancing detection. Small amount, again, it's already been used. And then the large amount of money for enhancing detection really did fund the majority of our activities in 2020 and 2021. So contact tracing, some minimal amounts of clinics went to that as well as some of the testing and work that we did around setting up some local testing. Grant dollars, we do expect to have a small amount of enhancing detection to carry over into 2022. And then the other three grant streams were built into the 2022 budget, recognizing that anything we don't use within the scope of work could be carried over for a year or two longer. Okay, so I just threw a lot of COVID information at you. Any questions on that before I move to other things?
Any questions for KT? Hearing none.
Okay. So the next thing that I wanted to share was our financials for end of year to our best guess. Let me share that so you can see that as well. There we are. So the first in yellow are our revenues. You will see that many of our budgeted revenues were very much off base when they were program generated income. So things like reproductive health, seeing clients and having program generated income. Because we weren't seeing clients, there was a significant reduction in billable interactions. So that revenue makes sense, even though it's unfortunate. And then we really offset that with the work that we were doing in communicable disease. And so that's where you're going to see the significant amount of ELC dollars and other grant dollars coming through to support the work specifically. So looking at a grand revenue as what we're expecting to see is 2.3 in revenue. And then if you go to the next couple pages in blue and green, these are our expenses. The vast majority of expenses are in our people time. So that includes the about 11 FTE that are our normal workforce and the expanded people that support contact tracing, immunizations, and other COVID mitigation strategies. So kind of scrolling to the bottom in a way that hopefully does not give you motion sickness to come to that final and oh, I guess there is one other thing I wanted to share. Sorry about that. In environmental health, there is one cost that is not represented just yet, and I wanted to call that out. At the end of the year, we had a significant transition in staffing, and in that transition in staffing, there was a risk that we were not going to satisfy our DNR, TNC, or WELL program requirements to do all of the annual site visits as well as some of the sampling. And so we reached out to our partners at DNR, and in the transition, they stepped in to help us do some of that work. And of course, as it's appropriate, instead of collecting revenue for environmental health work that we didn't do, we are then turning that back over to the state. So there's about $800 worth of expenses that are not represented in contractual services that will be. So I wanted to make sure that there was some awareness that that's not represented just yet. So there is still a little bit of shifting. And then also there was there are some finalizations that happen, some end of year changes that have already come through to you, but we do believe at the end of 2021, we will have a significant amount, about $5,000 worth of carryover for ELC, and then additional carryover for non-COVID items, but that we will have a significant amount of reduced levy, but the majority of that is going to get carried over to do the work in 2022 and beyond. Any questions about that?
Any question on revenues or expenditures or anything that Sarah wants to add? KT, you did a good job.
Hi, everyone. I don't have anything to add. Thank you.
All right, thank you, Sarah. All right. Finances update. Did you want to talk about anything else, KT?
I don't have anything else to share at this moment, unless you guys had any questions or anything that you wanted to talk about.
Anybody have any questions about the sort of new prioritization, whatever we're calling it, the new approach, the
Thank you for
review
helping
approach.
me center in on, yes, absolutely. I did want to talk through that. I'm
You have
so
every right to
sorry.
forget.
Also in what I sent out to you was a memo from the state, as well as a corresponding memo from national associations that represent people like me. So the National Association of City County Health Officers, as well as the same kind of representation for state and territorial epidemiologists, quite a few different groups coming together, really talking through prioritization of mitigation strategies, recognizing that because of the decreased, the timing has become really challenging for contact tracing. It's lost its efficacy in that it's a shorter isolation period. There's not as much time to make those phone calls, and it can be really challenging. In addition, there's a lot of testing that is not captured because people are using, hopefully, home test appropriately, so that they don't get a phone call. And so there is acknowledgement that as new treatments come online and become more available, and prevention through vaccination continues to be a good tool in our tool belt, that there is a need to shift our priorities. So the parallel conversation, and it's in what I sent out, is also from the state health department, sharing that their expectations of local health departments to do 100% contact tracing and disease investigation is no longer the case. And so that comes into line with what we're already doing a little bit, but it also gives us some more leeway to pull back from other groups that are not at high risk for adverse health outcomes or at high risk for outbreaks like jails and shelters and other congregate settings, long-term care facilities, to really focus that time on immunizations and focus that time on effective and timely messaging to the public, as well as getting back to some of the public health work that we need to get back to around community health improvement plans and some of the backbone of local public health. And so I wanted to make you guys aware of that national and local conversation. There is a possibility that there will be something from CDC that's similar, but we're waiting to see if that actually comes through. But you needed to have the awareness that the Dunn County Public Health team is still contact tracing people that are 60 and older, because that's where the majority of our deaths are coming from, and people that cannot be vaccinated, people under 5. But other than that, we are really working with the labs and the EHRs, electronic health records that are coming through the WEDS or Wisconsin Electronic Disease Surveillance System to chart on what is already coming through from those two sources. We are working to implement an electronic surveillance system called a JOT form, so inviting people to provide more information if they care for it, and inviting them to ask for a call if they care for it, say they need a return to work letter or something along those lines. And then finally, providing some dedicated time to answer questions. Right now, those questions go to somebody who's juggling immunizations and contact tracing and car seats. And so this will allow us to dedicate some time, instead of to contact tracing, to being available to those folks that do have tricky situations with isolation and quarantine, or did not test at a lab, but tested at home and want to know what their next steps are to keep their community and other people safe. So I wanted to give you guys some awareness on what the national and state conversation is, as well as how that translates to what we're doing here.
So some return to something, I hate to use the word, but approaching normalcy, core functions of local public health, which will be, I suspect, a very welcomed change. Any questions? Yes, Dr. Hall.
I just wanted to say that I was really excited to see these memos, and also really excited to see them lay out, okay, this is not a good use of our resources right now. And so let's shift to these other things, right? Our communications, all those types of things. And certainly, I'll be really interested to see how much is going to happen at the county level versus the state level in terms of just kind of public education campaigns, what to do if you test positive, and really pushing the messaging out there. Because if you follow the DHS Facebook page, right? But who does besides me and you, right? Who is that getting, right? So, if there's going to be radio spots or billboards or, ads that get pushed out onto TikTok or, Snapchat or something, to try to get that information to people of what to do if you test positive, and please tell the people who are close contacts now that, public health officers aren't going to be doing that. And also to let people know that public health officers aren't going to be doing that. It was interesting in the reading the documents, the one said, oh, you should still do outbreak investigations. And then it talked about how an outbreak is if you have 2 or more cases at a school. And I was like, oh, that horse is way out of the barn. We have handfuls of cases every day at the high school right now, and that's scratching the surface, I'm sure. But so I'm excited to see this shift towards different priorities, and I'm excited to see what might come out of it, because we still have a long way to go still. Even if things come down quickly, we still have stuff to do. So but thank you. And it's kind of exciting to think about doing something that is more than just kind of documenting the disaster, right? And actually put resources towards something that might make more of an impact. So that's exciting to see.
Yeah, thank you for that comment. I agree.
KT,
Any other
are the schools doing, I mean, I know what we're doing in Boyceville because we know the county can't keep up with everything. So I know that we're contact tracing, you know, in Boyceville. Are the other schools in our county doing that?
So they are. Thank you for that question, Bonnie. I have had a conversation with all of our school nurses, and there is a wide variety of ability and support for them. You know, as you know, in Boyceville, your school nurse is not full time, so that makes things really challenging. In other school districts, they feel like they have it really well covered with their staffing, and so they are contact tracing. All 4 of our districts are now live with on-site testing. There are still some, I would say, rough edges around the antigen shortage. So they are offering PCR testing. So if a kiddo is symptomatic, they can get a PCR test and wait for it to come back, and then have that 90 days worth of time where they would not have to quarantine again if they were exposed. So there's a benefit in that. But the real benefit will be kind of a test to stay model where they can test, and if they are not positive, stay in school. And I think that that's going to really reduce the number of lost educational opportunities. And the reason I kind of went down that rabbit hole, I apologize, is because if they're testing on site, it made sense in my head, it totally did. If they're testing on site, they're really able to follow up almost instantaneously with antigens. And so they have a much quicker response. So one of the school districts has almost like a checklist, like the kiddo leaves and they know what their test date was, they know that it was positive, and they know that these are what the next action steps are. And so they're doing the lion's share of contact tracing already in that school-aged population. And of course, we're always available if there is a particularly difficult situation, you know, say foster kids and 5 kids, and some are positive and some are not. And so we can always step in, or if there's a perception that maybe somebody is not being entirely truthful. It's hard to imagine that people wouldn't tell the truth, but it does happen. And so we can step in to support our school nurses in that way. But it is, I'm grateful to have the support in all of our school nurses that we do. We could not have done what we've done without them. They have been an amazing partner.
Yes, Dr. Hull.
Just add, I think it's pretty spotty, just because of the sheer volume. So I know a lot of parents, they're getting close contact notices that your kid was exposed 10 days ago or 14 days ago. You know, I know that my son was exposed at swim team on multiple occasions, but I think if it's in athletics, like somehow it just falls through the cracks. But the question I had was, it sounds like that kind of checklist that the one school or school district has developed is a really great tool. Is there any ability for the public health department to then maybe ask to share that with other schools as a best practice? Here's a tool that's out there. I don't know if school would be willing to do that. I don't see why.
That's where we're at. I've absolutely asked,
Awesome.
but today, so I just saw it today and I just asked today. So it's not like there's any evasion or anything. We have amazing school districts that are really looked at as leaders within the region. And so if we can do something, if a school district is able to do something successfully here, it's oftentimes replicated in other locations. And so that's my hope as well.
Great. Anything else for KT? Well, thank you for this report, KT, and as always for the incredible work that you and your team have been doing for, well, always, but in this particular pandemic for such a very long time. words can't convey how much we appreciate the work that you've done. So thank you.
Thank you.
All right, moving on to the Department of Human Services report.
All right. Well, I have a couple of,
I don't want her to talk about this, but she's gonna.
I'll
So
talk about
there.
some other things first.
So there.
So I just wanted to give a couple of quick updates. Last month, we talked about,
You're muted.
I see that I bumped my space bar. Last month, we talked in this meeting about just garnering your endorsement of us asking for additional CDBG money. And we did that, and our request was approved. So we will have $1.8 million additionally of housing, emergency housing and transitional housing, case management, supplies kinds of funding coming to
Awesome.
us.
Awesome.
And they're processing the contract right now. So that will, we're actually already spending the money. So, I mean, not we, but the organizations that West Cap and Stepping Stones are spending the money. Just on that same note, Stepping Stones is currently housing about 15 households. Household might be an individual, might be more than an individual, in hotel stays, spending about $20,000 a month. So, and again, even if we argued that they could do congregate sheltering, they don't have a congregate shelter to do that in. So they're still waiting to see on their recent grant
I was going to
submission.
ask about that neighborhood improvement
Yeah, there
grant.
must have been a pile of applicants is all I can figure, because they've been, we're supposed to know in December, and now we're through January, and kind of the latest is perhaps early into February, so that they'll know whether they got the money for the shelter construction. We also, Sarah will speak to this a little bit more in terms of what it means financially for us, but we did receive our CCS Cost Reconciliation for 2020, and we were made 100% whole for that program. So we continue to have been able to fine tune that to make that program self-sustaining, with Snow County levy actually a backfill of a bit of my time and a bit of Sarah's time and a bit of toilet paper and snow plowing and all those sorts of things. So it's that's been very good for us. And then the last thing that I would report on that part would just be that we had our very first, some counties will go probably their whole existence and not have this, but we had our very first what's called safe haven case. If you birth a baby in the first 72 hours, you decide that you do not want to keep that baby in an effort to keep those babies safe, you can turn your baby into a hospital, emergency room, fire department, or a police officer. And you don't have to provide your name. You don't have to provide address. You don't have to provide any follow-up information. There's no documentation required. You can simply relinquish your child. And so we actually had that happen this week. So, and I'm obviously I won't give you more information because I don't want to risk identifying anything that might identify the situation, but it's just interesting that the process worked. We just recently did about 6 months ago, we did follow-up training. We did not follow-up training. We did some just collaboration with the fire department, with the police department, with the hospitals, with us to say, hey, if this ever happened, and then it did. So, so that was good. So the last thing that I have to share in terms of the Department of Human Services report is that I am letting you know that I am going to retire in August, early August. And so that my retirement means that you guys all get to go to work. So I wanted to talk with you a little bit about what efforts I have made with regard to succession planning, and then also with regard to what your responsibilities will be over the next months to find a successor. So over the last more than a year, I have, Ken has denied my retirement request. Over the last year, I have solicited interest from within the county of persons who might be interested in my position and offered to begin to give them, much of the background data and information necessary to feel like they at least weren't starting from nothing if they were to move into that situation. So I've been meeting regularly, individually with a group of people. I guess that doesn't make much sense. We say individually with a group of people, but individually with more than one person on a monthly basis to kind of give them some background. So my retirement wasn't a surprise, obviously, to those folks or my management staff. I think that there are some internal to the county individuals who would be well qualified to move into that role. However, that's a decision that you all will get to make. So basically, we're going to have to do a little bit of background information, and I included the statute for you as a reference. So how a human service director comes into their position depends on the style of government adopted by the county. So in our county, we have an administrative coordinator called a county manager. That creates one path for a human services director. And in a county where there is a county executive, which is an elected position, or a county administrator, in those counties, there's a different path. So I'll go backwards and I'll say that in a county administrator and county executive form of government, the county administrator appoints the human services director subject to final approval by the county board at large. In an administrative coordinator or county manager, as we call our arrangement, the Health and Human Services Board does that appointment. So, and it's not subject to approval by anybody other than the Health and Human Services Board. So you will have some choices to make, and you're going to need to let somebody know what direction that you would like to head. So you have an opportunity to essentially relinquish the entire recruitment and hiring process to somebody else. If you wanted to do that, you could give that to the county manager, you could give that to the HR department, you could put that wherever you wanted to. You also could say, we would like some assistance with some parts of that. So you could ask the HR department or the administration department to do the recruitment for you, and to vet some candidates and make a recommendation to you on who to hire or who you might want to interview. Or you could say, can you just do the recruitment and we will screen the applicants and decide who to hire. You can do that way. You can do the whole thing yourself if you wanted to. I'm not exactly sure how you would necessarily do that, but you could figure out. So you'll have to decide, do you want to do an external recruitment to see what talent is available in whatever catchment? Generally, our HR department uses our county website, but also uses vehicles like Indeed, which is a popular employment site. And so if you choose to do an external recruitment, then that information would go out and you would get potential applicants from wherever people were able to access that information. And indeed, you could go as far as to say, we'd like to do a broader search. We'd like to hire a headhunter or someone to assist us in this process, similar to how they've done with some of the other, like a county manager or a CFO kind of a situation. Or you could, sorry, lost my train of thought. It's gone. So you have choices. Oh, or you could just do an internal recruitment. You could say, well, we're taking it on the good word of Chris Corpolet. There are some internal candidates, and therefore we're not going to do an external recruitment. We're just going to do an internal recruitment. So you have choices and decisions to be made, and they are fully yours to be made. Some of you, I think Gary was here. Gary might be the only one.
Probably Sarah was too.
Sarah, and Gary.
When you came on.
Yeah,
Oh,
when I
Sarah?
came on, and Bill Lamb.
Yeah.
Oh, okay.
So when I came on, the Health and Human Services Board asked for some assistance from HR and admin, kind of in the processing, but did the interviews and kind of directed that process and then selected their candidate, and then sort of deferred that back to administration to do the negotiations around salary and all of those sorts of things. So, because it will be, it takes a bit of time to work through those kinds of processes, depending on how broad of a search that you choose to make. I would make the suggestion that you might want to set that for discussion, what you'd like to do for discussion at your next meeting, and maybe invite the county manager and or HR to join you if you think that you're going to be in need of their assistance in all of this.
Yeah, I was actually going to suggest that perhaps Chris and I meet with Heather Murray, our county HR director in the interim, and that we put her on our February 24th agenda to lay out in maybe a package of 3 what our options are for moving forward. So that would be the bulk of our February agenda without any objection. And I'm certainly welcome to consider other ideas from the committee as well. No, sounds good. I tell you, Chris, you are going to be really, 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 really hard to replace.
Everybody's replaceable.
I know everybody is replaceable, and so the committee will do its due diligence and do the best job that we can to.
Yeah, I was just say, just don't hire somebody that's going to wreck it. That's all I care about.
No, we won't hire anybody who's going to wreck it. Absolutely not. That's not happening. Supervisor Bjork.
You're muted, Larry.
You're muted, Larry. Lower left. There you go.
There we go. First question is really simple. I guess I don't quite understand on the sheet that was sent out what it means when part of it is highlighted in blue. Does that mean what does that mean?
Those are the pieces that are applicable to this discussion. So there's a lot of information in there. There's 2 different ways that you actually get to have a Health and Human Services Board. So the first is if you have a county executive or a county administrator, they appoint the board subject to county board approval. And then, but if you have an administrative coordinator, then the county board chair appoints the committee. So first, I just let you know that you're here because you were appointed by the county board chair, which is based on the type of structure of government to our county. And then the next thing is that it makes a difference in terms of who makes the decision about the human services director. And again, in a administrative coordinator position or a situation, you do.
I got 2 other questions.
All right, go ahead.
And this is just only because I need to know, before your retirement and comes about, there will be an election, and this board could look completely different. Even the chair could be gone.
Yeah.
And so, I mean, anything can happen. And what I also don't know is, did the rest of the board, as far as appointment by the county board chairman, could, that could also make a difference in who this committee is. Is that correct? We have the election and then also the appointments to the committee.
Sure.
Okay.
I mean,
Yeah.
most definitely there will be some changes on whether or not they impact this committee or not. I mean, it definitely will have some impact because Sarah Kennedy's position on the board will be replaced after the election. So you have that piece moving forward. So yeah, there will definitely be some changes. How small or large that they are would remain to be seen based on the election.
Okay, and then the third one, and not trying to indicate anything. Last time you talked about this, that we were meeting in the old days where we actually sat down across the table from each other, and we got to know each other a lot better than we do now, I think. And the discussion was at that time that you had, I thought at one time suggested that it would be nice to bring in somebody within the county that could start learning some of the processes that you're already doing. And at that time, Mr. Miller was at the meeting, and I think he was pretty adamant in saying that there was not to be any preference to an appointment from within Dunn County. Now, as I read this here that you give us, that I guess that could be or couldn't be the case. I mean, that is it may just come down to what what this committee, HHS, decides to do.
That's correct.
And
That's correct. It is our choice.
It is totally your prerogative. Yep, your decision. And in terms of that was that early part of what I said about that succession planning. I have been meeting with people internally who have interest in leadership, additional leadership roles, to give them some background and preparation were they to step into this job. But there are a number of them, and obviously they're not all going to step into this job, or maybe none of them will. But we've done that level of work and planning that we can do, short of knowing who the next person will be.
And that was my last comment. I commend you on doing that. You wouldn't have to do that. I think it's the right thing to do. New and eager people are always, let us, they're ready to go. But it sure is nice to have a little bit of shared information prior to that. And you never know who steps, in the door to say, I want to do that job.
Well, and the other piece about that preparation is it's not wasted, because the more people who understand all of the ins and outs, the more they can rely on each other to support the transition, whatever that may look like. So, yeah.
And one of our expectations clearly could and should be, Supervisor Bjork, is that the new Human Services Director has a responsibility to identify and nurture leadership from within the department. That's an important role.
I agree.
Did you have any other questions, Supervisor Bjork?
Except if anyone's interested, I'm not interested in the job.
Okay.
So in terms of
timing,
if there were to be some overlap to the position of, say, I'll just pick a number, a month. And so that would put you back to the first part of July. Then if the person that was coming into the role was already professionally employed and would give minimally a month, maybe 6 weeks of notice on their current position, that would be back to the beginning of June, the middle of May. And then if you back that up, say a month for the actual job to be posted and there to be recruitment, you would be back to the middle of April. And if you deal with sort of we have to draft an ad and we have to figure out amongst ourselves what we're going to do and whatever, that will get you back to your March meeting. So if you do some decision about a direction you want to go next month, the timing will allow that to play itself out, and it never goes that smoothly. There's always glitches to hiring that delay the process, but in theory, it should allow you sufficient time to ask good questions, make decisions among yourselves about how you want to move forward, and feel like you are not rushed to get somebody on board.
The chair has actually taken the liberty of sketching out a timeline, and I would like us to be substantially through this process by May, which gives us 4 months. Yes, Dr. Hall.
So I love the idea of there being an overlap. I know that some employers won't allow that because then you technically have 2 people in the one job at the same time. Is that something that we are allowed to be able to do to allow for that onboarding of that new person?
Yes.
That has been prior practice on some of the heavier
Senior level
lifting,
positions.
positions.
Great, thank you.
Chairman Bartlett, did you have anything to observe or add? Since you'll be a critical part of this process too.
Well, I'm usually for recruiting from within a department if we can. So I'm fine with, and the committee can do whatever they want. And as far as Supervisor Bjork's concerns, he's right. The board could change, but it's not going to change completely. There's 4 members, I think 3 members that are not on the county board of this board. And there's at least 2 members that you guys don't have opposition.
Correct.
So if the rest of us all got replaced, the new chairman coming in is going to look at that. You're not going to put a completely new committee out there. I mean, that would just not make sense at all. So I would guess that the majority of this board is going to be the same, even if us 4 that have opposition in the election get replaced. So I think you should get going on it, and I wouldn't worry about those concerns, Larry.
Supervisor Steen.
Yes, thank you, Diane. First of all, thank you, Kristen, for your service.
Welcome.
I hate to see you go, and I wish you well with whatever you're going to do. Now, as regard to how we proceed here, Diane, I would urge even that you would consider a special meeting. I think we should get going the sooner the better to decide which avenue we want to do, because I think this this situation deserves our full attention for the hour or 2 or 3 that we'd spend setting up our direction. And then we should implement that so that we're as far along down the line as we can be, so that we give ourselves adequate time to not feel rushed, like Chris said, and also to do a good job. This is a very important job, and the learning curve is steep, and it's a complicated department, and it takes a long time to get the ins and the outs and to figure out your income and your outgo and how to balance that and give the board a reasonable proximity of where you're at money-wise. Would you agree, Chris?
Yes.
And so I feel this a complicated department, and I would urge haste, but deliberative work on doing it. And I was here for you, Chris, and I would, just off the top of my head, Diane, I would recommend that we would utilize some of the HR people and in our process. But just to soothe you, Larry, it's our decision, period. That's how it goes. And so regardless of what happens, I don't think we'll see a big change on the board. I hope not. But I can speak for everybody. I can't speak for everybody on the board. I can speak for myself. Everybody on this board that I served with from the very beginning, way back in the 80s when I was first on it, including in the 2000s now, everybody I've served with has the best interest of the county at heart. And that's the key of what we're doing here. We've had some good directors along the way too, but I can't stress how important this is to the county because of all the ways that we touch people's lives in Dunn County. So thank you for listening.
And with the committee's indulgence, I will confer with Chris and with Heather Murray, our HR director. And if it seems like we would need to speed this up in advance of our scheduled February meeting, I'll go ahead and call us a special meeting. Otherwise, we'll take it up in February and then move with, and you're absolutely correct, with all due speed and deliberateness. I don't know if any of you have just checked your chat, but VSO Officer Greg Quinn has just posted that the retirement request is denied.
Yeah.
I would like to say something though, for just as a teammate of Chris and stuff. It's sad to see more institutional knowledge leave the county. Great teammate, great partner, and it's a testament to hear how she mentors the growing leadership. That's a true leader. And so blessing working with you, Chris. I wanted it memorialized in the meeting.
Yeah.
Thank you. You're a great teammate.
Absolutely, absolutely. Well said. Supervisor Steen.
Yes, Chris, I want to apologize. I know you tried to educate this Norwegian and evidently you're giving up. I'm sorry I'm sorry I wasn't more receptive. Thank you.
It's been, I mean, you're still stuck with me for a while, but I have worked in the Wisconsin retirement system for 37 years. So I am ready to do something else. I will definitely keep working in some capacity, but I'm just ready to do something a little less intense. But this has been, Dunn County has been a wonderful place to work. And I am very proud of the work that we do as an organization, but I'm also very proud of the leadership that we've had in our county for a long time. And the support of staff and programs and the citizens. And there's a lot of really unique and good things that go on here. So that part's the hard part to leave, but not that hard.
And you certainly have earned this, and you have every right to move on to some new challenges, but you have done an absolutely bang up fabulous job here, and you really will be missed. You've made an enormous difference in the lives of the people of Dunn County. You really have.
Thank you.
Do we want to talk a little bit about money? And do you want Sarah to do that?
I do.
All right.
Hello, everyone. I will share my screen if I have authority, maybe. Let's see.
Did you get authority?
Oh, here comes. All right. This is the financials that were put in your packet, the summary version. I'll just go through it once and then I'll talk about some footnotes that I have. We have right now grand total of expenses at $12,873,420. We break that out into operating and salary. Operating is $7,882,035. And the salary is $4,991,385. It puts back to $12,873,420. Then it goes back to our budgeted expenses and revenues, what we have. And it looks like right now we're going to need $3,050,750 in county levy. We were budgeted at $4,178,916. So right now, the financials as when I prepared them about a week and a half ago, we were going to give back $1,128,166. And as Chris alluded earlier in the meeting, we did get our, I'll call it WIMCR. It's our Medicaid cost report funds back. And that total was $537,023.53. So that those funds are not here yet. And we also have about at least the whole month of December of expenses. And then we have some trickling in of state revenue and some insurance reimbursements and stuff that are not here. So this will not be the final December that you will receive. So there are still some more expenses coming in. There's more revenue coming in. So I just wanted to make sure that was clear and transparent to all of you. Are there any questions?
Any questions for Sarah or for Chris on the getting on to the year-end finances?
Our best guess is that it'll be about $1.5 million when all the dust settles. That will return to the general fund.
Okay.
And again, a lot of that, I mean, there's so many reasons why all of that is. Some of it is people aren't headed off to training. There's tons of free training. People aren't traveling. We have very limited travel costs, but we've also had a ton of money infused into the system in a variety of ways that have helped our bottom line dramatically. And our staff have worked really hard at some of our areas of previous high expenditures like children's placements and adult placements.
Yeah. Yeah. Any other questions? Supervisor Steen?
I see you're getting when the getting's good, huh, Kristen?
Absolutely. I am taking the advice of my predecessor, Cheryl Henick, go out when you're on top.
Go out on a surplus.
Absolutely.
All right, colleagues, we have one action, unless I'm foreclosing any further questions or discussion. I apologize. Thank you, Sarah and Chris. We have the December vouchers to note review. Let me pull up my, it's going to pull up the total and I have my pages. No. So the December vouchers, DHS vouchers paid total $764,149.87. I need a motion to note review. Supervisor Steen, is there a second? Ms. Barker seconds. Any discussion? All in favor say aye.
Aye.
Aye. Any opposed? The December vouchers are noted. And unless there are a lot of announcements or additional questions, we will be adjourned. Dr. Hall, did you have something? Okay. I will say I will not take up meeting time. I will send out an email to the committee. I did follow through and make a memorial contribution at the Neighbors for Sarah Kennedy from this committee. So I will send you the information on that.
Thank you very much, Diane. Thank you.
Yeah, and thank all of you for agreeing to participate, and we'll take it from there. Anything else? If not, thank you all very much. Thank the staff, thank committee members. Stay warm, stay healthy.
Yes,
And
please stay healthy.
Stay healthy, and we'll see you in